And it's an occasion to honor a very special couple, a couple that's dear to the university, dear to the School of Public Health, and that's Norman and Gerry Sue Arnold. And we're so glad you're with us here today and with your family. This is also the occasion of our 40th anniversary as a School of Public Health, and we almost made it on the same day as Norman Arnold's 86th birthday on this planet. So belated happy birthday, Norman. We have a very ambitious agenda today, but it'll be hopefully short. But I do want to speak to you briefly about the impact that Norman and Gerry Sue's gift, their benevolence, and especially your enduring friendship has had on this very special school. In 2000, when Harris Pastides was dean, the Arnolds made a very brave decision, a decision to give us $10 million to then name it the UofSC School of Public Health to become the Norman J. Arnold School of Public Health that we know today. And just in the past week or so, we put the name on this building, and we're very, very grateful, very thankful that we're finally able to get your name prominently on the Public Health Research Center of the Norman J. Arnold School of Public Health. So make sure you note that as you go out today. It's a lovely sign. In 2000, our school had only 545 graduate students. They were mostly MPH students, many that were employees of DHEC, and we had 242 undergraduates. Then we had 52 faculty, and we were graduating about 20 doctoral students each year. Our total research funding then, and we're very proud of that number at that time, it was the highest in the university, and it was $15 million. And I remember Harris was very excited because, I don't know if you recall, Harris, we won the university award for the largest increase in a given year for any college. Yes, those were some very good times in our, at that time, sleepy little School of Public Health. And then your gift came. Your gift came to the university, and really our excitement and the excitement that you'll see today and your colleagues gathered here at this moment, the excitement and the optimism truly knew no bounds, and our school took off. Today, our school, your school, still leads UofSC in research funding to the tune of about $36 million last year in competitive awards. But probably as importantly, most importantly even, we've grown to almost 1,800 undergraduate majors, 730 graduate students, and 132 very distinguished faculty, and most of them I can see are here today, so thank you for that. Last year, these faculty published 485 journal articles, a record for the school and for the university. They mentored 288 doctoral students. That was triple the pre-gift years. 40% of our students today in the Arnold School are doctoral students, and we graduate more doctorals than all but 5 schools of public health nationally. And nationally, there are 56 accredited schools of public health with another 6 or so that are undergoing accreditation. So you might ask, Norman and Gerry, so how can that be? How can we possibly have that kind of productivity? Well, since 2008, when we really started seeing the benefits of your gift, the proceeds have grown to support more than 100 Arnold doctoral fellows, and they're gathered here today, and they'll meet you at the end of the ceremony, and we'll get a group picture. They're remarkable young individuals, the very best in the country, indeed the best in the world. Many are internationals, and they're all very proud to be supported by your gift and your generosities. And Norman, I also know how you love a good deal. So you need to know that these funds, by Dean Tom's law, and these faculty will tell you, the funds have to be leveraged 1-to-1 or better with grants or contracts, so we double or more the impact of your original gift. That's how we're able to do it. But it's the hard work of these faculty and students and staff that get it done. I also know how very proud you and Gerry Sue are of the school. You tell me that when I visit. It gives me a warm feeling in my heart. And by anyone's reasoning, when you look at how well this school has done, you could both have simply said to me, Tommy, you've done a great job. Harris, you've done a great job. We appreciate it. Job well done. Thanks for your efforts. You've made us proud, but we have other things we want to do now with our philanthropy. But that's not you. And that's why we're here today. We're here today to make a very special announcement. You've remained faithful to your school. So at this time, I'd like to call the 28th President of the University of South Carolina. Harris, if you'd come to the podium and tell everybody why we're here today. Thank you.
Well, thank you, Tommy. Thank you, Dean Chandler, for your outstanding leadership of the Arnold School of Public Health. The school turns 40, and you're going to turn 40 one of these days as well. What a wonderful day. I am truly proud, honored, happy to be with each and every one of you, student, faculty, staff, donor, partner, and friends of Norman and Gerry Sue, each and every one of us. Back in 1998, when I assumed the deanship of the then University of South Carolina School of Public Health, I had no idea that one of our greatest benefactors would soon become one and then two of my greatest friends. Norman and Gerry Sue honored the School of Public Health, as you've heard by Tommy, with one of the then larger gifts that had ever been bestowed at the university. And when other deans of public health started hearing about that, they said, who is Norman Arnold? How did he come to respect and believe in public health? And by the way, what's his phone number? Well, the first two answers were quite easy to answer. I told them that Norman Arnold was many things. A man of humble stock, humble beginnings, whose dad, through his brains and hard work, Ben Arnold, the senior, developed a successful business right here in Columbia, a statewide business. Norman was a man who earlier in his life than he planned or wanted to, had to take over his dad's business when his father passed away far too early. Who was Norman? A man whose support and generosity was expressed passionately whenever it was given, was expressed passionately to groups that included the Boys and Girls Club of the Midlands, many Jewish community projects, not only in the city of Columbia and in the state and across the ocean to Israel, with Gerry Sue's wonderful support of Hadassah Hospital and affiliated organizations. Who was Norman? He was a man who had a brush with very serious illness. Well, let's call it what it was, if it's okay, Norman, a brush with death. And through a dogged determination to live, and by adopting a nutritional philosophy that some thought was beyond the fringe of traditional medicine, he survived. And on November 21 in the year 2000, when Norman spoke at the dedication of the Norman J. Arnold School of Public Health, he told how he came, quote, perilously close to dying with some accumulated wealth. He went on to explain his basic truth, and I quote him again from that day. He said, not the least of which is the ultimate value of good health and loved ones. But also I learned that dying with accumulated wealth is like burning up a diamond to prove you had one. It's a good story to tell, but you're still left with something pretty worthless. Those were his words 14 years, 11 months, and 23 days ago, November 21, 2000. He added that he saw a much better purpose to wealth, that it could be used for the betterment of society through the fundamental mission of public health and creating a healthier community. Norman's phone number, by the way, I never did give out. In the years since, and Tommy has described some of it, we became, of course, the Arnold School of Public Health. We've recruited better scientists, attracted better students, more research funding, saw our exercise science program soar to the #1 spot in the country, and exceeded, I would say, most every one of our expectations. But more than anything, the school has had an immensely greater impact on the students being educated here and by the communities that are supported by our school, far and near. There is no doubt, especially to my public health colleagues here gathered, that we would consider that a causal relationship, the Arnold's gift and the success of the school. Today, the Arnolds have pledged an additional $7 million gift, which will create the Gerry Sue and Norman J. Arnold Institute on Aging, and that will help us to advance age-related science, which is important for each and every one of us. What do you all think about that? Even the 39-year-old Dean Chandler would agree that we need age-related science. And as we transition, and we'll welcome Norman and Gerry Sue in a few minutes, but one of the best examples of this change that I've been talking about is Professor Julius Fredrickson. A leading expert in stroke recovery, Julius has changed the way that we treat stroke survivors in the Midlands and in the country. And through his research, he's brought in with his colleagues, more than $10 million in external funding to the school. I'm sure Norman and Gerry Sue and Ben, you would all agree that Julius epitomizes the caliber we seek in our research scientists at the Norman J. Arnold School of Public Health. Help me welcome Professor Julius Fredrickson.
Thank you, Dr. Pastides. Good afternoon. In the popular media, you hear all the time that we only use 10% of our brain. Now, this of course is a myth. We use 100% of our brain, not all of it at the same time. But for all of us here, during the time of this ceremony, you will have used every one of the neurons, or the brain cells, if you will, that you have in your brain, which is about 86 billion. And all of those will have fired at least once, many of them millions of times. So we need all of our brain. When it comes to aging, is the problem as we get older, into our 50s, 60s, and older age, is that those neurons start dying off at an accelerated pace. What is interesting, however, is that some people age without losing much, if any, of their mental faculties, while others suffer greatly. For example, those with Alzheimer's disease or stroke are not as fortunate. The problem with those cases is that very significant loss of brain cells leads to problems with functions such as memory and the ability to speak and understand speech. What the Institute for Aging will allow us to do is to further study why some people age better than others when it comes to brain health, as well as to better understand how we can improve the recovery of people who have sustained very major brain injury. Mr. and Mrs. Arnold, the way that I look at your gift to establish the Institute for Aging is that you and I are partners. You've provided an enormous resource that will enable us to accelerate the pace of our research on the aging brain. It is my responsibility, as well as the responsibility of many of the faculty members of the Arnold School, to make sure that the resources you have provided will be used responsibly and in a way that it benefits as many people as possible. On that note, I want to thank you for your enormously generous donation, and I applaud you for your continued dedication and belief in the faculty, staff, and students of the Arnold School of Public Health. Thank you. Next up, we're going to have my colleague, Dr. Michael Beets, who's going to speak about childhood obesity. Thank you.
So I want to start by expressing my sincere thank you to both Norman and Gerry Sue for their generosity to the Arnold School. And as many of you know, that part of the endowment is going towards funding research related to childhood obesity. And so part of this gift will be used by the faculty in the Arnold School of Public Health to help leverage our competitiveness to seek out external funding for NIH center level grants that will focus on improving the health and wellness of children in both South Carolina and across the nation. And I know that both Norman and Gerry Sue understand that the investment in our health of our children is an investment in our future. Faculty at the Arnold School will use this investment to help develop programs that help children maintain healthy weight. We will expand on our work that we do collaboratively with our community partners which include the South Carolina Department of Health and Environmental Control, the Department of Education, the South Carolina Department of Social Services, the Boys and Girls Clubs, and the YMCAs across the South Carolina. And we will work with them to learn how we can best create healthy environments for children that help them sustain lifestyle habits that lead to maintaining a healthy weight. Some of you probably already know that South Carolina ranks 10th in childhood obesity across the nation, and that even some of our communities just a short distance away from where we stand today are burdened with some of the greatest rates of adult and child obesity. With this generous gift made by the Arnolds, we will tirelessly work to change these kinds of rankings so that in the not too distant future, we hope that people look to South Carolina for ways to get things done and for what to do to help children lead a healthy lifestyle. Again, I extend this great appreciation to Norman and Gerry Sue for this opportunity that I think that both the community, the school, our state, and the nation is going to thank you for helping us create a healthier future for our children. Thank you.
So, I'm the community partner, Boys and Girls Clubs. My name is Carter Clark, and I'm here to bring this sort of full circle. Because not only are the Arnolds incredibly generous in the endowment in putting all of the money into this great program, but the Arnolds have also been incredibly generous to the community at large as well. As we speak, we've got workers that are furiously working on bettering the facility and expanding the facility of their namesake, now named the Norman Arnold Boys and Girls Clubs and soon to be Teen Center. Now, it did not take us as long to put the name on the building, I'm just saying. But the work that we're doing in the community is paired with the work we're doing with Michael Beets and his team in helping to provide not only a great space for the kids to come, a first-class environment for them to be involved in, but also first-class activities, first-class programs. And Boys and Girls Clubs, as many of you are aware, our entire being is to take things that kids like to do, to teach them the things that they need to know to be successful today, tomorrow, and well into the future. And that's exactly what you've enabled us to do, both through the physical surroundings and also through this partnership. So on the behalf of the 4,500 kids that we see each week and the 7,200 kids that we receive each year who are benefiting from your generosity, thank you.
It's always nice to hear examples where the work we do here has come full circle into the community, and I know our researchers and our students really appreciate the Boys and Girls Clubs and the access that you give them for the important work that they do, so thank you, Carter. At this time, we'd like to hear from just a couple of students, Norman and Gerry Sue, that have benefited from your benevolence, hear a little bit about their story, and I'd like the first one to come up is Alexandra Vasilakos, who is a student in Communication Sciences and Disorders with Julius Friedrichsen. If you'd come up, Alexander, to share with us a few remarks.
Thank you. And first, I wanted to thank you all for this time to say a few words about what being an Arnold Doctoral Fellow has meant to me, and also just how important this endowment from Mr. and Mrs. Arnold is to the students of public health. I'm sure a lot of us today have come into the field of public health to help people in some way. And as a student, a speech language pathologist, and importantly an Arnold Doctoral Fellow here, I've been able to see firsthand just how the research that takes place within the Arnold School has helped the lives of many individuals across the lifespan. In my case, every week when I attend our weekly stroke support groups, I'm reminded of just how important our work is to our support group members and their families, many of who have been attending our weekly support groups for years, and in some cases close to 10 years. Knowing that my work here benefits these individuals on a weekly basis serves as daily motivation to myself. Additionally, I've realized throughout my time here as an Arnold Fellow that each of us students, along with the faculty and administration that support us, are making an impact. And not only by providing services to those who live in the state of South Carolina and take part in ongoing projects throughout the Arnold School, but also through the dissemination of our work. Over the course of these past years as a PhD student, I've had some amazing opportunities here, and none of this would be possible without the mentorship I've received and the collaborations between researchers within the Arnold School who are leaders in their respective fields. When I attend conferences, almost everyone I meet knows of UofSC's research reputation and the quality of our work. And last and most importantly, this work would not be possible without the patients and families who donate their time, and in our cases, days, hours, and even weeks for some of our studies. I'm confident that this generous gift from Mr. and Mrs. Arnold will provide countless opportunities for years to come, both for current and future Arnold Fellows, and especially for citizens in the state of South Carolina and surrounding areas, and all of those who our work reaches. So on behalf of the other students, I would like to thank you for your generous donation.
Thanks, Alexandra. Now I'd like to hear from Morgan Clennon, who's in our exercise science program. Morgan?
Thank you for the honor to speak here today. It's a pleasure to be in such great company. As a recipient of the Norman J. Arnold Doctoral Fellowship, I've been directly impacted by the generosity of Norman and Gerry Sue Arnold. I was deeply honored to be selected as a recipient of the award, and I wish to express my sincere gratitude and appreciation for your gift to not only me, but the rest of the students that have been fortunate as well. For me personally, the Arnold Fellowship has lightened the financial burdens of graduate school, and it has allowed me to focus on the more important aspects of my education. Specifically, I have been able to dedicate more time and focus to developing my skills as a public health researcher. In an effort to address childhood obesity, my research aims to identify effective policies and environmental interventions that promote physical activity among all children and adolescents. We know not all communities are created equal. They do not offer the same opportunities for children to be healthy, and that disparities exist in children's opportunities to engage in physical activity. Through my future work, I hope to address these disparities and to help create communities in which all children have the opportunity to live, learn, and play in environments that support a healthy and active lifestyle. Thanks to the contributions of the Arnolds, I'm one step closer to accomplishing my goal. On behalf of all Arnold Fellows, I would like to extend our great appreciation to Norman and Gerry Sue. Your investment in our education and development of tomorrow's future public health leaders is important. This fellowship has supported countless students, all of whom are the future of public health. My hope is that together we can work as an interdisciplinary team of researchers who will all make significant contributions to our respective fields and ultimately tackle some of the greatest public health challenges of the 21st century. In closing, I would like to read a quote from the Dalai Lama. "Just as ripples spread out when a single pebble is dropped into the water, the actions of individuals can have far-reaching effects." Norman and Gerry Sue, your generosity and support throughout the years to both the Arnold School of Public Health and numerous Arnold Fellows has shaped many lives and will have far-reaching, rippling effects on the health of our communities, our state, and our nation. So thank you very much.
Would you come up and make some remarks?
Thank you, Tom.
It's an honor.
Great pleasure. Thank you. Good afternoon. We are pleased to be here today participating in the announcement of our gift to fund this new institute. The Institute of Aging will, as the name suggests, examine stroke recovery, dementia, and other issues that are associated with our elderly population. But please understand that childhood obesity and good nutrition will be a critical part of this mix and our mission. We have wonderful leadership in Dean Chandler, and Harris been especially fortunate to have a university president, Harris Pastides, who has a background in public health. So I am confident in the direction that this institute will take. When I spoke of my cancer history 15 years ago, I ended my remarks with a prayer of thanksgiving for the time to enjoy my life up to this point. That would have been enough, yet here I am today. So my prayer, and I'm still here, so our prayer for us today is that you too will be blessed with the gift of long life, and that one day, not too far off, we will have many fine reasons to come together to celebrate the new Institute's important achievement in healthy aging. Thank you, and God bless.
One final thing. 2 weeks ago, Norman and Gerry Sue were named the 2015 Philanthropist of the Year for the state of South Carolina at a very nice ceremony over at the Marriott. And we in the Arnold School, the faculty and the students, would like to start a new award in the Arnold School, an award called Public Health Heroes. And we're going to give it every year to individuals or a group or organization in the community that has a significant impact on public health in the community, in the nation, or in the world. It'll be named for you both, but as the first winners of this award, the 2015 Public Health Heroes will be Norman and Gerry Sue Arnold of the Norman J. Arnold School of Public Health. You think they should open it? Sure, absolutely, yeah. He comes prepared. He's got his penknife.
I don't know. Oh, wow. Oh, that's beautiful. Oh, look at this. Beautiful. That is beautiful.
Thank you. It's a blown glass bowl by a famous artist named William Dexter, and it's from his series called Fluid in Motion. And you've certainly helped keep the school in fluid motion for a number of years, both of you, and we're just very grateful for this day, for your gift, for this community of scholars, of students, and I wish you long and happy lives, and I'm just so delighted to have your friendship and your love, so thank you. And thank you, everyone. We've got refreshments inside. We've got a good spread. Please eat it. Okay, Norma would like to make one more comment.